Hello, welcome everyone to Revive Health's Daily Briefing Live for Tuesday, April 28th, 2020. This is our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators who are dealing with the COVID-19 crisis. I'm Chris Bevelow, Health Systems Practice Lead at Revive Health, and your host for the show. I am joined by Chase Kleckner, Senior Marketing Manager at Revive Health, and our show's producer. Hello, Chase.
Hey, Chris, good to see you.
Good to be back. Thank you. We are also joined by Sasha Bogosian, who is EVP and head of our Insights group at Revive Health. Sasha is a veteran strategist who helps healthcare organizations define their brand, connect with their consumers, and build the future they desire. As head of Revive's Insight group, he is responsible for our agency's approach to diagnosing our clients' problems through research and data analysis and for charting the course to deliver the right solution. Hello, Sasha.
Hey, Chris, thanks for having me.
Yeah, so glad you could join us today. We're going to get into some research that you've been spending a lot of time with. So looking forward to diving into that.
Exciting stuff.
Yes, definitely. And for those of you who want to know what that research is about, so you can hang in through the first 5 minutes here, we have done some additional research on hesitations and fears consumers and patients have about returning to the hospital post-COVID for regular care. And so Sasha's going to give us some insights into that. It's proprietary research, so we can't share all of it, but we'll give you some good takeaways from it. As with each show, we're going to cover things like that related to marketing communications for hospitals and health systems. We'll highlight a couple of resources, talk about some news. As we move through the show, we want this to be interactive. So if you have a question for Sasha or myself or Chase, please put it in the question queue at the bottom of your Zoom window. We'll get to as many questions as we can at the end. You can also use the chat function in Zoom if you want to talk to other attendees, and Chase will be using that to post links as we go forward. But if you want us to answer a question, make sure it ends up in the Q&A queue only. Remember, you can subscribe to this podcast if you don't already. We're getting increasing numbers of people who listen via podcast versus coming live, which is understandable, but we still appreciate you folks who show up every day or whenever you can to the live show. You can search for Revive Health Daily Briefing Live on iTunes for that. Also know that we post a recording of the video version of this show on our website by the end of each day. So go to thinkrevivehealth.com. Also go to thinkrevivehealth.com/COVID19 for our hub. For all kinds of content. We've got all kinds of great stuff there. And we've added a new section that is focused just on rapid recovery. So there's resources there. We had a great webinar last week. Was that last week, Chase?
Yeah, last week, last Tuesday.
Gosh. Seems like it was forever ago. Just last week, just a week ago. So definitely something to take a look at as we see hospitals and health systems starting to reopen, as states are reopening slowly. Really trying to make sure that you guys are out there and protecting the surgical and procedure volumes that you had scheduled but were postponed or canceled, as well as trying to build more share if you can. Such a critical time given the financial impact that you've all faced over the past couple of months and continue to face as we move forward. So definitely check out those resources. So let's move to the news. Like we do, we start each show with the news, and we start with case count. We do that to try to keep things in perspective. We have been obviously dealing with this crisis kind of increasing here in the United States. I would say, obviously, it varies depending where you're at. We are at different places, but we seem to be moving through the peak and hopefully on a downslope. The question is, how quick will the downslope be? And obviously, as we start to reopen, is that going to trigger more cases than we were hoping to have because we're being too aggressive? We don't know that. It really depends on what you look at. So really important that we keep an eye on all that so we have that context for our discussions. We use the Johns Hopkins University tool. And when look at that today, internationally, we have over 3 million cases now, 3,063,814 confirmed cases, which of course is really important. And then confirmed deaths from COVID-19 globally is 212,000. 345. When we look at the United States, we are encroaching on the 1 million mark in terms of cases, 994,625. Again, that's confirmed. And same with the death count, which is now at 56,749. So we're going to be hitting that 60,000 mark sometime this week. I think what's really important, again, is this is using both for cases and deaths, confirmed only. And that's important because there was news stories that hit yesterday. I think they initiated with the Washington Post. I could be wrong about that. That looked at the overall death count, just death count overall from any causes historically. And you see kind of this path, and then you see this huge leap way beyond what you would attribute to the confirmed cases of COVID-19, which tells us a couple things. I think, and Sasha, I'll ask you to weigh in here on this one. One, it tells us there's probably more cases of COVID, deaths from COVID than we have confirmed, because things like pneumonia or whatever might not have been attributed to cases. The second is, we've been talking about this for a while. A lot of people are avoiding the hospital. We're going to talk more about that. And we've seen some reports of dramatic decreases in EDs across the country for things like stroke and heart attack. And if that's true, then those folks are an increase of deaths from those things as well. Anything you want to add to that, Sasha?
Yeah, I think the numbers generally have been really surprising to me. The severity of the decrease in terms of ED visits for things that are pretty acute, stroke, heart issues, very surprising, and that sort of fits in pretty neatly with the data that we've gotten back from our research in terms of just how much fear there is out there among people about being exposed to COVID-19 if they enter some sort of a healthcare facility.
Yeah, I mean, we've talked to some folks out on the East Coast. Obviously, that's probably New York, New Jersey. That area has been hit harder than almost anywhere. And hearing stories about EMTs being turned away, just saying nope. You know, they have to basically just not provide the care. If they can provide it right there in the ambulance, that's great. But if you're having a heart attack, you need to get into the hospital. And so, it's hard to know how they're going to reassess or whether they will reassess the official counts based on this. We know that at some point, if you look at the national, the death count, it kind of goes like this, and then it spikes in mid-April, and then it comes back down a little bit. And that spike is attributed to New York City, basically saying, okay, we've relooked at a bunch of deaths. We didn't call them COVID because we hadn't done the test, but now that we relook at them, these were clearly COVID, and they added them to the death count. So you saw a spike. Who knows who would do that from a national level or whether we'd even want to do that. But obviously, the more transparent the data is, the better off we are. So maybe at some point we'll get a clearer picture of that. Let's one more thing before we get to what Sasha referenced, and that's the research. Remember, a couple important notes. We are not experts on COVID-19, so this isn't a place to come for medical or scientific advice. But as you've already heard, and you're going to hear more of, we definitely have opinions on marketing communications for hospitals and health systems related to the COVID-19 crisis. But everybody's situation is unique. So make sure you take anything we're telling you and put it through the filter of your own situation in your organization or your market. So I wanted to say that. And then again, just a reminder, we have other research on that hub at thinkrevivehealth.com. Just go there and go to the top. We've got a banner up there that'll take you to all the content. We have repeated a national survey 3 times now. The latest of which I think is a week, maybe just a little over a week old. Really good content in there. But Sasha, what we want to talk about is a certain aspect of the latest version of that research, which started to get at the fears people had. And then we took that and expanded that. So why don't you start by just talking about what we did in terms of that survey. And then let's just start at the highest level in terms of fears people have.
Sure, I'm happy to. So as we think about slowly sort of reemerging from COVID-19 with hospitals sort of opening up and starting to provide services to patients in need, we thought we really need to understand what the obstacles might be to patients who really need healthcare services that might keep them from walking in through the door. So we've approached the research in a couple of different ways. The first is really quantitatively trying to assess what some of these obstacles are. So we went out and conducted a national poll among a specific subset of consumers. So we targeted patients who had insurance coverage, who were between the ages of 35 and 80, and who either had a surgery scheduled that was delayed because of COVID-19, or feel like they have a pretty serious health issue that's emerged that requires surgery today. And those are that's the specific subset we talked to, because as we emerge from all of this, those are going to be the first patients that all our health system clients and the folks here on this webinar are going to be focused on. And we really need to understand their mindset and the feelings that come with sort of what they know they need from healthcare, so that we can understand how to get around some of these obstacles that might keep them out.
Yeah, so we're gonna give some high level takeaways from that. Again, I mentioned at the top of the show, this is proprietary research we've done for clients, so we can't share out a report like we've done with the other surveys we've done. So there won't be a follow-up report on this, but we can still share some takeaways that we think are important for people. And obviously, again, we just talked about the situation in some hot spots around the country. Let's talk about some of those fears, Sasha. Like, what are we hearing?
Sure. I've the one thing that pops right out at me is the level of fear that's sort of pervasive throughout this consumer set. So again, these are people that either had something scheduled or know that they need some sort of surgery. So their health situation is pretty bad. But among them, 9+ out of 10 say that they have some sort of level of fear associated with coming back to a healthcare facility. Now, this isn't today. The way we've formulated the question was really trying to ask them, when COVID starts to fade in your community, how will you feel? So this is sort of a future tense question. And even within that sort of a setting, 90+% of the people that we talk to who know they need acute healthcare services today are paralyzed with fear in terms of walking into a healthcare facility. And that, I mean, even for me, in having sort of been in this environment for the last couple of months, helping clients through COVID messaging, that was really astounding to see that level of fear among patients.
I think the distinction, and this is an important distinction you mentioned, this particular survey was only focused on people who had a procedure scheduled or who know they probably need one. Our other research was just anybody. And you can imagine if you don't have those, that you'd be like, yeah, I'm fearful. I'm not going to come back in. I'm not coming in for 6 months. But if you've got something, now it's not just a theoretical kind of consideration. It's a real decision that you're putting off. You're facing something that is in most cases likely causing you pain. It's causing you fear of debilitation, of chronic issues, potentially death. Like, these are the things people are facing. And yet 90%, or even, I think somewhere it said like half, extremely concerned, right? Am I getting that stat right?
That's right. So this issue isn't some theoretical thing for this subset of patients. This is real life and death. And among them, 5 out of 10 said they're extremely fearful, really debilitated by the fear. And 9+ out of 10 overall have some level of fear associated with walking into a healthcare facility. And I can sort of unpack that a little bit, because there are lots and lots of important elements within it. First off, to us sort of healthcare insiders, there is a logical difference between a hospital setting and an outpatient setting. But when we drill down among these patients, there's essentially no difference. They don't see shades of difference between types of facilities. Any facility that provides healthcare services, they're afraid of, and they sort of equate the level of danger in their own minds, whether it's an outpatient facility or the ER of a hospital. And that's really significant for us, because we thought that one way we might be able to sort of get around that is in talking to patients about safe outpatient settings for the surgery that they might need. But again, what the research is telling us is we're going to need to overcome fear even within that setting the way we would have to in talking about bringing people to a hospital setting.
This is so important because so many of the guidelines we've seen, AHA, CMS, some state level guidelines, talk about one of the strategies for reopening postponed services is to, if you can, concentrate COVID treatment in one facility. So if you've got multiple hospitals, for example, which allows you to open up the other facilities, right? Which still is a sound strategy. There's nothing wrong with that strategy. It makes all the sense in the world. What this research tells us, just like you said, Sasha, is we can't assume that just telling people we've done that is going to be enough. We're going to have to spend time educating them on the differences. And it's just a reminder that we get so stuck in our own world, right? You know, when you step out, if you have nothing to do with healthcare and you think about even the word like outpatient, it's an outpatient surgery center or it's an ambulatory surgery center, which a lot of people probably go like, what does that mean? The ambulances take me there? Like what? They have no idea what that stuff means. So it's, I guess in that sense, it's not surprising. But boy, we're going to have to really overcome just a basic lack of understanding about how the health system works.
Yeah, that's exactly right. And the general sentiment that's coming out of this research that we're doing is it's mostly difficult news for us, because what it's telling us is it's gonna be a little bit tougher and it's gonna take a little bit longer for us to overcome these obstacles that stand in the way of patients who really need our services and us providing those services. So just one other sort of facet of this particular issue around fear that I thought was fascinating. So we asked, when it's safe, how are you going to feel about walking in? And then we tried to do some work with these patients to really understand their definition of safe. So we asked first around, hey, how long do you think it's going to take before COVID-19 starts to fade in your community? And the average answer sat somewhere between 3 and 6 months. So again, we're trying to get at data that helps us get out of our own point of view and understand the patient. Lots of states are already sort of reopening healthcare services, right? So you've got hospitals in Ohio and other places that are resuming surgery today. But from the patient's perspective, safety isn't coming for another 3 to 6 months. So they're not ready to accept your interpretation of safe. And we went a little bit beyond that and asked around the signals that people might interpret as markers that safety has arrived. So we asked around issues like, will you be convinced that COVID-19 is fading when the president issues a certain advisory, or your governor does, or healthcare experts provide some sort of updates or advisories? Or will you be watching new death and new case counts? And by a pretty vast majority, people take new case counts and new death counts as the marker that signals to them that COVID-19 is starting to fade. So again, even though you might have easing around social distancing and other policies at a state level, people who are the patients we want to target, they're not necessarily looking at that as the signal to know that it's starting to be safe again. They're looking at case and death counts, just like we reported earlier today, and that's the signal that they're looking for. So again, even though you may be looking at reopening today, from a patient's perspective, your safe reopen date may be 2 months down the road. And even at that point, when they consider it safe, they still have a debilitating level of fear in terms of walking into your facility. So the window is very small in terms of when we're going to be able to get people who need our services in through our doors.
Yeah, so there's an aspect of that, and I don't know if our research dug into it, but we rarely talk about politics, if ever, on this podcast. But I've got to imagine that if you looked at that and you skewed it based on political affiliation, you would see very different answers, right? You would see people who interpret, for example, let's say my state, Minnesota, which when you look at the death count, we're kind of peaking now. I think it's in the low hundreds total, right? You compare it to New Jersey and New York, it looks like nothing, right? To be honest, to be fair about it. And so there are going to be people that interpret that like, what's the problem, right? They're not going to have their fair, like it's not even a problem to start with. Where you've got other people who look at that and go, yeah, we have been pretty aggressive in this state in terms of stay at home, social distancing. We've clamped it down. That low count isn't a sign that it's not a problem. That's a sign that we've been doing the right things. And we know that that skews politically already, those perceptions. And to the degree that people are going to be fearful, I think would align with that to a degree. I don't know, Sasha, if we broke it down or asked people in terms of answering the survey, but something for people to consider as they go out there with their messages.
Yeah, I think that's an important point. We didn't look at political affiliation. We've got sort of geography tied to our answer, so that's one way to look at the data. And like you mentioned earlier, we're doing this sort of partly on our own and partly in support of the work that we're doing on behalf of clients. So in certain markets, we're a lot deeper in terms of the quantity of results that we're looking for. And it is interesting to see subtle differences from market to market in terms of how these answers skew. But in general, sort of directionally, what it's telling us is that there's just a level of fear that is really tough to overcome from a sort of a logical argument standpoint. I think the top line sort of takeaway for me is we're not going to be able to sort of rely on people to use their own logic to overcome fears. What they're telling us is they really need to be reassured, and they need to know levels of detail about the most mundane things that we would consider sort of run-of-the-mill operations issues in order to be convinced. And that's sort of the next finding is more than ever, these patients want to know exactly what we're doing to keep them safe. And it's sort of been fascinating. Chris, you and I have talked about this before. 6 months ago, you couldn't imagine a marketing campaign that talked about the cleanliness of your facilities, but that's really what they want to know. And they don't just want to know that it's clean. They want to know how we cleaned it and how we're keeping it clean every single day in minute ways that provide an opportunity for us, if we have the right things to tell them, to create some reassurance and trust with this audience that's desperately looking for that.
Yeah, and I think that's a great point, and it extends beyond cleanliness, though I think that's the most interesting example of it. But for example, a lot of the guidelines talking about kind of revisiting the waiting rooms and not having standard waiting rooms. You can't just have a waiting room, people come sit wherever they want to. You're going to have to structure it in a way that people are keeping their distance. You're going to have to minimize, if not eliminate, patient interaction with each other. So if you've got rooms that are double rooms, those are out. Just kind of like the airlines went away from middle seats like a month or two ago. That's the kind of specificity that people need. I feel better flying if I know there's nobody else in my row or nobody behind me who's going to cough in my head. Right? We're going to have to demonstrate that. We can't just say we've taken steps to minimize danger. Like even the word minimize makes me wonder, right? Like, well, great, you've minimized it, but that means there's still a risk, right?
That's right. It's been fascinating. So we asked a lot of very specific questions to better understand what information people are looking for. And that information really falls into three sort of lumped categories. The first is separation or segregation of COVID population from all else. So they want to know exactly how you've sequestered COVID patients that you're treating from the experience that they're going to have. This is physical separation, different buildings, different routes that are taken in and out of the facility, different sort of greeting areas where they check in, all of that. The second is all of the procedures you have in place with your clinical staff and your admin staff to minimize any sort of risk. So what is it that your nurses and doctors are doing specifically to wear protective gear, to sanitize everything that they touch, and how they interact with you to bring the risk down as far as you can. And then the last is sanitation. So what's happening with all of the things and the places that patients come into contact with? How are they being cleaned? How often are they being cleaned? How long are they being cleaned? How is waste material being disposed of? They want to know every element of that. And it was fascinating. There was no amount of information that was too much information, which was really fascinating. And it speaks to the level of fear that there is out there.
So we're just about out of time. I'm going to give you a chance to wrap up with one thing. I think the one point I want to make on the last thing you said is that last point you made, I think, is really important, that there's no amount of information that's too much. But as communicators and marketers, in some senses now, we're back to putting our marketing hat on. We have to think about how do we cascade that information. You can't include all of that in a "we're open" ad that goes out to market. You're going to have to figure out the best way to give people enough confidence to dig deeper for that information that they want, in what way they want it. Because some people care more about cleanliness, some people care more about the distancing, some people will care more about just overall. So you're going to have to be flexible in providing that level of content, and that can't all happen in a "we're open" ad. So we're really going to have to work hard to connect those dots for people.
Yeah, and that's sort of another fascinating element of this, is that typically there is a saturation point of how much our consumers want to hear from us. But in this case, we tested as much as twice a week, and that went over perfectly well. These patients are perfectly willing to hear from their hospital, not even particularly their doctor, but their hospital twice a week between now and whenever they end up having their procedure done. And that enables us to have lots of opportunities to come in with different touches, with different messages that sort of complement one another and build trust over time. Because that's really what we see the assignment as, is just because you had a patient scheduled 2 months ago whose surgery got delayed doesn't mean they're ready. And the thing you have to do between today and when you get them ready to come in through your facility is build trust one layer at a time, by convincing them that you've done everything you can to take the fear of exposure out or minimize it as much as possible.
Yeah, that's great. That's a great place to wrap. I think, there's so many obstacles that folks have to overcome: loss of insurance, their prior authorization has lapsed, maybe whatever pre-op medical situation that they had to be in to be able to have the procedures now not up to snuff. They have to be retested for things. They have to meet their standards again. So all of that operationally has to happen, and you still have to overcome these things. So we got a lot of work ahead of us, I think is a good way to put it. So Sasha, thank you so much for joining us.
Yeah, of course. It's been fun. Thank you.
And we're going to continue this research. So we may have you back to see if there's more that we can share. Is that an accurate thing to say, since I already said it out loud?
I think we started off by saying that we're taking a couple of different cracks at this. The first was polling to understand quantitatively where people are at. We're in the process now of interviewing this subset of patients, so having in-depth conversations with them to really get at the emotions and pressure test a lot of this. That's going to be fascinating work. The first one's scheduled today, so I'd love to be back if it makes sense to talk about what we found.
Definitely. But thanks for joining us. Really appreciate it.
Absolutely.
Chase, thank you, sir.
Absolutely. Glad to be here.
Tomorrow we have Christian Barnett, who is head of our strategy group here at ReviveHealth. We're going to be talking about brand, which we've touched on now and again, but haven't really delved deep into. Remember to go to thinkrevivehealth.com. Banner at the top will take you all our good COVID-19 content, recordings of this show, the research we've alluded to, the surveys we've done nationally, and also rapid recovery resources. It's all there. Subscribe at iTunes. And as we sign off every time, to all you marketing and communicator folks at hospitals and health systems, keep up the good work. We know this is a really difficult time, but what you're doing is so critical to the patients you're serving, to your organizations, and also to our country and to the world trying to get through this pandemic. So hang in there. We will be with you every day until this crisis passes. So thanks for joining today, and we will talk to you tomorrow.